Hello guys, it's Tanvir again. Welcome to my channel. Today we are going to talk about acute pericarditis. So, what is pericarditis? Basically, it's the inflammation of pericardium, and the condition is more common usually in young adult. What are the causes of pericarditis, which are relevant to UKMLA part 1 or PLAB part 1? There are a lot of causes, but I'm going to talk about the causes of pericardium here very briefly. So basically, there are some viral causes, bacterial causes. Among them, most common are Coxsackie virus or tuberculosis. The other causes are like trauma, uremia, and patient with history of myocardial infarction and connective tissue disease. The trauma case, usually if there is a history of trauma and patient gets pericarditis, then there is a chance that patient may get a cardiac tamponade as well, so which is very, very dangerous. What are the features of pericarditis? Usually pericarditis presents with a chest pain, which can be very sharp, stabbing chest pain or central chest pain, can radiate to shoulder or upper arm, and by sharp mean chest pain can be pleuritic and often relieved by sitting forwards. It may catch the breath, means origin by inspiration and origin by lying flat if patient is coughing or swallowing. On examination, you may get pericardial friction rub, which is pathognomonic for pericarditis. The other symptoms may include a non-productive cough or a shortness of breath. Now, another important thing is that what is the ECG feature of pericarditis, or we can say what kind of test we are going to do in pericarditis. So in case of pericarditis, we can do routine bloods and ECG. In ECG, we are going to find out like things like PR segment depression along with widespread saddle-shaped ST elevation. You can see a small picture of ECG there. So the ECG can be like the apple like this. There is PR segment depression and saddle shape ST elevation. Another important thing for PLAB part 1 or UKMLA part 1, that it's very important to understand the difference between acute pericarditis and cardiac tamponade. In case of patient with acute pericarditis, when cardiac tamponade is not developed yet, usually patient comes with a history of flu. There can be central chest pain or some inspiration, or patient can complain that he's catching breath and there is pain, and definitely you may find pericardial friction rub. But in case of cardiac tamponade, there is a triad. It's very important to remember the triad, that muffled heart sound, which is a faint heart sound, and JVP can be distended, and patient will have hypotension. You know the ECG feature. I already discussed about ECG feature. And sometimes in pericarditis, troponin is raised, and echocardiogram is the diagnostic test for pericarditis or cardiac tamponade. In chest X-ray, if there are pericardial effusion, we may see enlarged globular heart. And regarding the treatment of pericarditis, usually I'm going to talk about the treatment on the later part. You may know about the definition of cardiac tamponade, which is a life-threatening condition. If there is a rapid development of pericardial effusion, then we call it cardiac tamponade, which needs urgent medical attention. So what is the management and treatment of pericarditis or cardiac tamponade? In case of pericarditis, usually acute pericarditis is self-limiting, and we can prescribe things like NSAID or high dose aspirin, and with or without, if patient's condition is not improving with or without, we can add colchicine. Corticosteroids should be kept reserved for patients who are immunocompromised and can be prescribed if there is an immune cause, and should be prescribed by an expert. If patient has high risk things like high fever, or patient is not stable, then the patient should be admitted in hospital for further attention and evaluation. It is advisable for the patient to reduce activity until the inflammatory markers are normalized. And if a patient who is athlete, then it is advised to avoid exercise for at least 3 months. Now let's talk about how a case pericarditis can come in licensing exams like PLAB 1 or UKMLA Part 1. For example, it can come like a patient who was hit by a car or bike, or there was an accident, any kind of trauma to the chest, and go to the emergency department. For example, if his neck veins are distended, heart sounds are muffled, and the patient is hypotensive, you can see this is Beck's triad, and which is a diagnostic triad of cardiac tamponade. So the most likely diagnosis would be cardiac tamponade. What would be the most appropriate management in that case? Pericardiocentesis, urgent pericardiocentesis. Just like we have talked in our previous slide, you can see the treatment of cardiac tamponade is urgent pericardiocentesis. So the next scenario, if a patient who comes with the recent flu or flu-like illness, and a patient presents with chest pain which is pleuritic or sharp in nature and worsens by respiration with or without fever, without a pericardial rub, the most likely diagnosis would be acute pericarditis. And if there is no cardiac tamponade, if there is no pericardial effusion, the treatment would be should advise the patient about that it is self-limiting condition, and we can advise NSAID. So what did we learn today from this lecture? What is pericarditis? What are the causes of pericarditis? Very briefly, what is the most common features of pericarditis? Beck's triad. The ECG finding of pericarditis. What is the difference between acute pericarditis and cardiac tamponade? And the management of acute pericarditis and cardiac tamponade. Thank you guys for listening to my lecture, and see you in next lectures. Thank you so much.